I greatly appreciate this opportunity to be able to share some background information about the demographics in rural, as well as some important social determinants of health to consider as we begin this workshop. Just to put in context, as Lars said, I am with the Walsh Center for Rural Health Analysis. We have been in place for almost 25 years. We are part of NORC at the University of Chicago, and I work out of our Bethesda, Maryland office. So let's begin with some background on rural demographics and social determinants of health. First and foremost, approximately 60 million people are rural Americans, and 1 in 5 are considered rural. However, the demographics in rural America differs than the demographics in urban America. And I think the most striking difference is really looking at the age distribution of our populations. And if we look and compare rural with urban, 40 years ago, the population 65 years and older was actually smaller in rural America than it was in urban. But over these last 40 years, we've seen a dramatic shift in a higher proportion of rural older adults living in our rural communities, with approximately 18%, almost 1 out of every 5 rural residents is a person 65 years and older. And that provides a lot of different opportunities and challenges for rural communities. One of the things that's important is to think about where our proportion of older adults reside. And if you look at this particular map that is from USDA, you can see that a lot of our older adults retire in rural areas that have recreation or are retirement destinations. But we also see the green on the map indicates counties in rural America where we have a persistent population loss, where we have seen over the last 40 years a number of people out migrating from that rural community to find jobs in urban areas. So we have a distribution of rural elderly that is somewhat different than what we see in metro communities. For example, you can see that in the central Great Plains and the West, we have a higher proportion of counties where we have a high proportion of older adults residing. We also see a different distribution in terms of comparing rural and urban with regard to racial and ethnic minorities. And as you can see, racial and ethnic minorities comprise about 22% of the non-metro population compared to 42% of the metro population. And I know Jan is going to talk to you. One of the things that's a bit challenging when we do rural health research is that oftentimes rural is referred to as non-metro. And a lot of us in the rural health research world would really like to look at looking at rural populations compared with non-rural areas. But again, as you can see, the distribution of racial and ethnic minorities is very different when we compare rural and urban areas. And to give some context, whites comprise about 80% of rural residents, whereas whites comprise about 58% in urban areas. This slide provides some background information on how our adults and our different populations across racial and ethnic minorities are arrayed. And as you can see, when we're looking, especially at that 65 and older, the highest proportion of adults by race or ethnicity are white older adults that are 65 and older. But when you look at our young adults in our country, the highest proportions are Hispanic, Asian, and American Indian. And when we look over time, these last 20 years, where we've seen the greatest growth in racial and ethnic representation in rural communities, it is among the Hispanic and American Indian and Alaska Native populations. We also have seen some very interesting changes in terms of how migration has occurred across the country. The red indicates a decrease in net migration, as in a loss of population, whereas the dark green is a higher net in migration. And those in migration areas really are areas, once again, that are more destination areas. A lot of them have recreation opportunities, particularly when you look at the West. There are also some job opportunities too that are highlighted by the darker green. So we see different shifts in the way that people are moving across the country. And one of the things that's very fascinating that happened over this time period between 2012, 2013, and 2016 to 2017 is that we saw a change in the energy extraction. For example, in the northern part, in North Dakota, in my home state, and the eastern Montana border, there was a large loss of population because people left, because those jobs left when there was a change in oil prices. So some of our net migration that we see is impacted by jobs. Others are impacted by the desire to live in recreation or retirement destinations. And we've heard too, post-COVID, that a lot of people left their urban areas and went to their second homes, which are located in our rural areas. So it will be fascinating to see how this map may change in the next 4 years when we are now able to demonstrate that we can work remotely quite successfully, and will people decide to maintain their primary residence outside of some of those larger urban areas after this COVID experience. Now I'm going to shift gears a little bit and talk about social determinants of health. And as many of you know, in public health, we often talk about social determinants of health as those things that contribute to where we live, where we learn, where we work, where we play, and where we pray. All the different contributions to our health and well-being. And we're going to have some discussions that focus a little bit more on health and healthcare, so I won't cover some of those as much, but I will share a little bit more about what it means for rural communities with regard to economic stability and some of the considerations that we know we need to take into consideration, because in public health, we often talk about wealth equals health, and having a livable wage with compensation that includes access to affordable health care and health insurance is a real important component of that ability to live with health and well-being. So with that, I'd like to start with some information about rural and urban employment. This data goes back prior to the recession that we had in the late 2007 to mid 2009. And as you can see, at that time, when we look at the differences in employment, we were pretty comparable. But I want you to see what has happened over time. Rural areas or non-metro have not been able to ever come back to where they were post-recession in 2009. And again, this data is going to be very important to track with COVID, because we know that there are a lot of small businesses. We've certainly seen a great downturn in the ag economy. How is this going to look as we go forward? It's a very important consideration, because we had not gotten to where we were 10 years ago before COVID arrived. So again, rural communities have been challenged with being able to attain their their employment. We can also look at long-standing poverty rates. And again, when you compare non-metro, which is the blue line, with metro, which is the orange line, you can see over time, we have made great strides, certainly, when you compare what we had in rural communities versus urban communities in 1959. However, we have never been able to achieve the same affluence of urban communities in rural. And that difference consists over time. So once again, we are looking at a difference between about 13% and 16% metro versus rural communities. It also differs when we look across the country. And again, when we look at non-metro and micropolitan, and those are small rural areas, when you look at the green, those are areas, and the darker the green, the higher percentage of population that is in poverty. And again, you can see across our country where we have concentrated areas. You can see in Appalachia, along the Mississippi Delta, some of our border states. And then when we look in the West, those areas are primarily American Indian tribal communities, and in Alaska, they are Alaska Native communities. We also see when we look at persistent poverty, and these are residents that have been, or these are counties that have been in poverty for over 40 years. Once again, you can see that it is most profound in our rural communities. And once again, you can look at the areas that are highlighted in dark red, and you can see that in Appalachia, in our southern states, as well as along the Mississippi Delta, the border, the Mexico border, and then our tribal, American Indian, and our Alaska Native counties, we see persistent poverty, and that has long-lasting implications for health and well-being. We also see differences across racial and ethnic disparities, and again, the highest proportion of people living in poverty are rural residents who are Black or African American, as well as American Indian and Alaska Native. And across all racial and ethnic populations, you can see that our rural residents live at a higher percentage of poverty than urban. Likewise, we see that 1 out of 4 of every child in rural America is living in poverty. That is very different than less than 1 in 5 in our urban areas. And again, you can see across the continuum that rural, no matter what age, are more likely to live in poverty than our urban counterparts. We also have challenges with access to food security, which is part of social determinants, with low access to grocery stores. Again, this data, the darker the red, the higher the percentage of population with low access, which is more than 30 miles to a grocery store. And again, we can see that a lot of that access challenge is focused in central and western areas where we have much more sparsely populated communities and larger distances to travel. There's also some challenges with housing affordability. And again, these are represented by the different colors, and the darker the red, the more expensive it is to be able to afford housing versus income. We have also done some additional research, and we will be looking at information pertaining to being able to maintain homes. For example, some preliminary work that we did in the state of Missouri found that although housing was affordable, the cost of electricity was not. So there are a lot of things that contribute to rural residents being able to maintain residency in safe and affordable housing. I also wanted to provide resources. Should you be interested in looking at addressing different social determinants of health in your rural communities, the Rural Health Information Hub has a number of different toolkits that are available, and they've got a very comprehensive one that is located at the website below this picture from the RHI Hub on social determinants of health. So I want to make sure that I leave you that although there are many challenges in rural America, there's also many innovations, and there's a great deal of resilience in local solutions to address challenges. And so with that, this is my contact information, and I'll turn it over to Jan.